Hi everybody, I'm Naufal. Welcome to my channel. Today we will discuss regarding the introduction and the components of mental health. Okay, we will discuss regarding the mental health. We are going to learn regarding the mental health nursing. So we have to learn regarding the mental health as well as mental illness. Okay, so today we will discuss regarding mental health. So what is mean by mental health? Before moving to the topic, you should know regarding what is health. According to the definition of WHO, health is a state of complete physical, mental and social well-being and not merely the absence of disease and infirmity. So regarding the health, you can't say a person he is healthy if he is physically fit. If he is physically fit, you can't call him he is healthy. He should be mentally fit. Okay? He should be mentally fit. He should have a good mental health. That much important is there for mental health. Okay? In the definition also, in the definition of the health itself, you can see mental health. Okay, so you can call a person healthy if he is physically as well as he should be mentally fit. That is health, and we are going to see regarding the mental health. Okay, regarding the mental health. So mental health means if a person is not having any mental illness or if a person is not having any mental disease, can you call that person is a good mentally healthy person? Can you call? No, because mental health is not only the absence of mental disease. Mental health is not only the absence of mental disease but also the ability of the person to cope with the stress or to solve the stress, and he should be free from the anxiety and he should have a positive attitude towards the life. Okay, so mental health, a mentally healthy person should be ready to solve the stress, ready to cope with the problems, ready to solve the problems and the day-to-day stress, as well as he should be free from anxiety. Okay, he should be free from the worries, as well as he should have a positive attitude towards life. Okay, if a person is not having any mental disease, you can't call him as a mentally healthy person, but he should have the capacity to solve the stress and he should be free from the anxiety and he should have a positive attitude towards life. Okay, then only you can call it as a good mental health. So a good mental health means he should be free from mental illness as well as he should have the capacity to cope with the stress, he should be free from anxiety and he should have a positive attitude towards self. Okay, so you can call it as a mentally healthy person. Okay, if a person is not having any mental disease, if a person is not having any mental illness, but he can't cope or he can't solve his stress and he is under anxiety and he is having a negative attitude towards his life, means he is not mentally fit. He should have the ability to solve the stress, he should be free from anxiety and he should have a positive attitude towards life and he should be free from mental illness. That is mental health. Clear? Next we can see the definition of mental health. You will get a better idea regarding mental health when we learn the definition of the mental health. Okay. So the definition of mental health is an adjustment of human beings to the world and to each other with a maximum of effectiveness and happiness. An adjustment of human beings to the world. Okay. First step, an adjustment of the human being to the world. So mental health, you can define the mental health as an adjustment of human being to the world. So the mentally healthy person will adjust to the world. He will have a adjustment to the world. That means the environment where he is living. He will adjust to that environment. Now you people are college student. Before you were in the school, the environment is changed, but you are adjusting to that situation. After completing the course, you will be employees. You will work in a hospital or in any other organization. So the environment is changing, the world is changing, but you are adjusting, you are coping to that changing situation. So the definition is an adjustment of human beings to the world and to each other. And to each other, that means, and to each other means between the individual and the world, also to each other, that is adjustment with the family, adjustment with the friends, adjustment with the society, and adjustment with the country. Okay, a mentally healthy person will adjust with his family. He will have a good relationship with the family. He will adjust with his friends, and he will adjust with his society, and he will be a member of the country. He will have a good adjustment. Okay, always keep it in mind, adjustment of the human being to the world and to each other. Okay, with a maximum of effectiveness and happiness. Okay, this adjustment will be with a maximum of effectiveness and happiness. He will be happy. He will be very much happy to adjust to the changing environment, and he will be happy to adjust with the family members, friends, society, and with the organization or with the country. With the maximum effectively he will adjust. Okay, not in the minimum point, at the maximum level he will adjust, maximum level effectively, and he will live in a good happy life. Happiness and the effectiveness will be there in the adjustment. So in that definition you can see the adjustment of the human being, where he is adjusting to the world and to each other. He is adjusting to the world and to each other with a maximum of effectiveness and happiness. That is the definition of mental health. Next we can see the components of mental health. The components of mental health. First one is the ability to accept self. The ability to accept self. That means you are accepting yourself. You are accepting yourself as you are. That means you have a self-respect. You are respecting you. A mentally healthy person will respect him and he will love him. If you respect yourself and if you love yourself only, you can respect others and you can love others. So a mentally healthy person will accept self regarding his strength and weakness. A mentally healthy person will accept his strength as well as his weakness. A mentally healthy person know regarding his strength and he know regarding his weakness, and he is accepting, he is ready to accept that. For example, a nurse who is having very much skill in doing the nursing procedures. Okay, for a nurse, she is very much skilled in doing the nursing procedures. That is her strength. And her weakness is anxiety. Every time she is having anxiety. So that is the weakness. But that nurse is accepting her strength. That is, I have the skill to do the nursing procedures. That is the strength. And I have anxiety. That is the weakness. So that nurse is accepting both the weakness as well as the strength. Okay. So accepting the self is the first component, that is self-respect. You are accepting yourself regarding the strength and weakness. That is the first component, the ability to accept self. The second component is the capacity to feel right towards others. The capacity to feel right towards others means, here in the first component you are respecting yourself. In the second component, that is the capacity to feel right towards others, means you are interested in others' problem. Okay, you are interested in the growth and welfare of others. You are ready to help your family. A mentally healthy person, okay, a mentally healthy person is ready to help the family, ready to help the friends, ready to help the society. Okay, he is very much interested in the welfare and growth of others. Not only for him but also for others also he show very much interest. He will help the neighbors and he will have so many friends. He will have so many friends and that relationship will be lasting. He will keep that relationship properly. Okay, so he is responsible for the others' problem as well as for the growth as well as for the welfare of others. He will take the responsibility of the family, he will take the responsibility of the friends, and he will take the responsibility of the society. That is the second component. And the last component is the ability to fulfill life's task. The ability to fulfill life task. Every day a normal, mentally healthy person will face so many problems. But he is ready to solve that problem. Ability to fulfill life's task. That means he will set the goals in his life. He will set some goals. I have to achieve this, and he will work to achieve that goal. As well as he will face the problem. He will face the problems as well as he will try to solve that problem. He will try to find out solution for that problem, as well as he will live in the reality, not in the fantasy. He will accept the problems that is occurring in the life. He is living in the reality. He is not living in the fantasy. That means he is not in a dreaming mood, or he is not daydreaming. Okay, he is living in the reality. He is accepting the problem and he is trying to solve that problem, as well as he is trying to achieve or fulfill the task of the life, that is the goals of the life. I have to complete these things by this date. So he will try to complete that things. He will work towards that. He will try to solve his problem, and he will live in the reality, not in the fantasy, and his emotions will be under his control. His emotions will be under his control. That is, the emotions are the fear, anxiety, and angry. Okay, all these things will be under his control, and he is ready to solve his problem, and he is ready to achieve his goals, and he will try to solve his problem as well as he is ready to face the problem. That is regarding the ability to fulfill life's task. Okay, that's all regarding the introduction and components of mental health. We will meet soon with another video. Till that time, thank you and goodbye.